Welcome, viewers, and I am very happy to be back with my second session about menstrual cycle. And my name is Sister Dr. Juliet Wangui Macharia. I am a gynecologist, but also I am a fertility educator and a medical management doctor. I deal with the issues pertaining reproductive health, pertaining infertility, pertaining menstrual disorders, and many more. And today, when you look here, we have some graphs. You can see they seem to be graphs. But this is what a normal woman in her reproductive age should have this. So, a woman in her reproductive system or a reproductive age, she normally has got hormones. And these hormones, they normally interplay with each other. When this one rises, this one lowers. When they rise at particular, this one has to come down, the other one has to rise. And this is what you can see here. God was so creative. He knew that he created a woman in a manner that when this hormone rises, this one should go down. When this one goes down, a very important thing is happening either in the ovary or in the brain or in the endometrium. But when you have what we call menstrual disorders, when I talk of menstrual disorders, this I mean women with maybe excessive bleeding, women with the irregular bleeding, a woman with the intermenstrual. You find that she bleeds today, then after 1 week or 2 weeks she bleeds again. Then the others, they stay for more than 3 months or 4 months, then they start bleeding. Others, they continue bleeding, either spotting or heavy bleeding, or just they cannot stay without a pant or a pant liner. So women who do not ovulate, I'm always proud to be a fertility educator and medical management. And one of our teacher, or we call her Professor Vigil Pillar, has written a very nice book. Ovulation is a sign of health. And I take it as a slogan because when I meet with women who do not ovulate, I know this graph is not normal. This graph is confused. And if this graph is confused, remember it is not only in the endometrium, because that is always what people think about. That because the bleeding is coming from the uterus, then the problem is in the uterus. Forgetting that for this coordination, this up and rise, this rise and fall of hormones, they cannot take place if there is no proper coordination in the brain. So when you have excessive bleeding, there is something wrong with the coordination from the brain, and the way they are communicating with the ovary, and the way the ovary is communicating with the uterus. So it is not only the uterus. And that's why I always tell my students, when you become a doctor, when you become a gynecologist, it is not a matter of removing the uterus. It is the matter of understanding the root cause of the problem. Why is this woman or why is this young girl bleeding? So when you tell her, okay, because you are bleeding too much, let's remove the uterus. Well and good. The bleeding will stop because the endometrium is normal, but the brain remains, the ovary remains. What have you done? So, look at this. We have 1, 2, 3, 4. And each one, if you don't understand, you may get confused. But let's start with the first one. When you look at down here, we have different colors. We have the red here. Then we have a pink. Then we have gray. We have blue, light blue, and then dark blue, and then we have gray, and then after this we have another bleeding and another menstrual cycle. So when a woman is bleeding, something is happening in the brain. The follicle stimulating hormone is being released. When the woman bleeds, the follicle stimulating hormone, which is in red, you can see here, this is the follicle stimulating hormone. I just want to see you, to show you how they rise and fall at what particular time in the cycle. So the follicle stimulating hormone is the one which rises when the woman starts bleeding. Why does it rise? It rises because the brain is telling it has noted that the endometrium now, the left endometrium is no more. So we have to prepare another endometrium. And for the endometrium to be prepared, we need estrogen. And for the estrogen to be prepared, we need follicles in the ovaries. So the follicle stimulating hormone is being released all the way from the brain. It goes to the ovary, and it tells the ovary, you know what? The endometrium is no more. Can we try now to make follicles so that we can now prepare this mother or this lady for another cycle? So the ovary is there. It releases the follicles. We have the different types of follicles as they grow. The antral, the primary, the secondary, then the Graafian follicle. We shall have that diagram later. But now, when the follicle stimulating hormone rises, the most important you as a student to note is that it has its effect in the ovary. And what is it doing in the ovary? It is telling the ovary to release follicles. That is why it's called follicle stimulating hormone. So it stimulates the formation of follicles. And there we have the follicles. So when the follicles start growing, they start producing a very important hormone in any woman in this planet, and that is the estrogen. And where is the estrogen here? This is the estrogen, the one in pink. You can see how beautiful it is. Look at how many times it rises. Yeah, it will rise a bit. A bit it has been formed. Then it rises. There's a estrogen rising, and then it reaches its peak, and then it falls. Then towards the end of the menstrual cycle, it rises a bit, and then it falls. That's how the estrogen does. But without follicle stimulating hormone, we cannot have the estrogen. So the estrogen is a very important hormone. Why is it important? Because the estrogen, when it starts being produced by the follicles in the ovaries, it starts producing, the woman notes some mucus in the vulva. And this is what you can see. When it starts rising, the woman notices some mucus. And not only the mucus, we shall look at the role of the cervical mucus later. The mucus is a sign that this woman is producing. But as the estrogen continues to rise, when it reaches its peak here, this woman will experience a stretchy and very clear cervical mucus, a sign of estrogen at the peak. We have some women experiencing very sharp pain if the ovary or the Graafian follicle is coming from the right or left. She will feel a lot of pain for some hours, and then it goes. And we have some people who do not even understand why they normally feel that, but we normally have that. So when the estrogen reaches peak, it sends some messages to the brain again. Hey, Mr. Brain, I have reached the climax. Can you tell another hormone called luteinizing hormone to come? Because this woman is just about to ovulate. And the brain releases another hormone called luteinizing hormone. And here we have the luteinizing hormone. It has been very low. You look at it all through the follicular phase. It has been low. But then when the estrogen reaches peak, the luteinizing hormone peaks. You can see how it has a very sharp rise. And then within a very short time, it has a very sharp fall. You see, sharp and then sharp. So this one tells you something. So the luteinizing hormone does not take long in the woman's body. It is very important because without this luteinizing hormone, a woman will not ovulate. Without the luteinizing hormone, the woman cannot conceive. But again, remember, without the estrogen, we cannot have luteinizing hormone. Without the follicle-stimulating hormone, we cannot have the estrogen. So we have the follicle-stimulating hormone, we have estrogen. When it reaches its peak, then we have this sharp rise and sharp fall of the luteinizing hormone. It stays in the body of a woman for about 36 hours. And then it goes, it falls. And you can see it falls completely. So it only has a rise during ovulation. This is when we turn this is a woman at her fertility time, and you can see here it is time of ovulation. That is when the follicle. But what is the role of luteinizing hormone? It has a very good role. It is the one which is responsible to break the ovary so that that kind of the Graafian follicle can get out. And once it has been released from the ovary, then it can meet the sperm and it can be fertilized. But without the luteinizing hormone, that breaking is not there. Without the luteinizing hormone, there are changes that needs to occur within the Graafian follicle prior the ovulation. Then if it is not there, those changes cannot happen. And what this woman cannot conceive. So we have so many women complaining that I normally see my cervical mucus, but I'm not getting pregnant. Yes, you may have the estrogen, but this estrogen is very low to make if it does not reach the peak, so that the message can be sent to the brain to release the luteinizing hormone. You cannot conceive, you cannot ovulate. Then we tell you, when you come to me, I'll tell you, yes, I understand you are producing estrogen, but the estrogen is very low. It does not reach the peak. I will tell you, let's check the estrogen at particular day of their cycle, and we are able to see it is low. So without estrogen reaching the peak, we cannot have the luteinizing hormone, and you cannot conceive. So you are not infertile. God did not create you to be infertile. But what is making you to be numbered or to be among that group is because of low estrogen. The moment the luteinizing hormone rise and fall, that is a sign that the ovulation has taken place. The estrogen, when it rises and falls, that is a sign that ovulation has taken place. So we have women with very high estrogen levels. They cannot conceive because we need this up and down, rise and fall of these hormones so that we can be able to tell you that you are able to ovulate. And if you're able to ovulate and you want to conceive, you are able to conceive. Immediately, this hormone falls, the estrogen falls, and the luteinizing falls, a sign that ovulation has taken place. We have a very sharp rise of another very important hormone in a woman's body, and that is progesterone hormone. And this is the progesterone hormone. You can see we can call it dark blue. You can see it rises. It rises. It is a very sharp rise of the estrogen. After ovulation, you can see it rises. Then it starts slowing down and it goes down and the woman is back to her menstrual. So, my point is, as a good doctor, as a good clinician, always understand the menstrual pattern of your patient. We shall go deep into this because most of the gynecological issues lies at the menstrual cycle. The menstrual, I normally say it is a menstrual ovulatory cycle in a woman in her reproductive age lies in it. It lies the solution of many gynecological disorders. The gynecological disorders that women suffer from, if you understand the patterns of this very important cycle, you will understand. It's like the history of presenting illness. You get to know where the disease is. Because we always say, majority of the diseases that women have lies behind these patterns of the menstrual disorder. A woman who comes to you complaining of chronic back pain, dry sexual intercourse, she complains of low abdominal pain, recurrent infection. Ask her, does she has this? Does she has this? And does she has this? She may not understand this, but in a very simple way, you ask her what you think she is able to tell you, and that is, do you normally see the cervical mucus? Do you feel some wetness in your vulva at some particular time of your cycle? Some will say yes. Then go further. Ask this patient, what is the color? Or what normally do you normally find at your panty? Some will tell you, I find brown. Some will say brown, I mean cream. Some will say white. Now, when you come to my office, I normally have got water, I have a chalk, and if I have something which is creamish, I have them. And I will tell my patient, tell me, among this, what is the color of the discharge that you normally see? Some will point the cream. I always see this. This is what I normally see. Others will tell you white. But some, very few, will tell you, you know what? There's a time I normally see something coming like a mucus. How does it look like? It's something that it's stretchy and it does not have some smell. What next? How is it? And normally it is something long. They try to explain to you, no, okay, this lady is ovulating. Some because they are ovulating, but because they don't check, they may not be able. So it is upon you to teach them so that they may understand this, because it is very important. So a woman who has recurrent pregnancy loss, woman who gets pregnant and then within a very short time, she loses the pregnancy. Check at her cycle. And this is why we normally check even the progesterone hormone, because a woman who does not ovulate or who has got ovulatory, we call them ovulatory dysfunctions, even when she becomes pregnant, she has a very high risk of losing that pregnant. So abnormal hormones will not allow a woman to have a good pregnant to term unless we correct it. A young girl is coming to you with excessive bleeding. She's just bleeding all through. She has bleeding for more than 7 days and above, more than 10, and it's heavy. She has a problem. So understanding this menstrual ovulatory cycle is very important. So I request you, my students, to go and read more. When we come back and discuss in depth the patterns of menstrual cycle, we shall be looking, we shall have the brain, we shall have the ovary, and then we shall have the endometrium to see the changes that are happening in the ovary, the changes that are happening in the endometrium, and what the brain is doing to these two very important organs in a woman. So remember, the follicle-stimulating hormone will rise. During ovulation will rise a bit and then it falls. The estrogen will rise, will start rising after the follicle stimulating start falling. And then you can see it has a very nice curve. It rises very fast. And when it reaches peaks, ovulation, and then it drops, it falls. So there is rise and fall of estrogen hormone. The follicle-stimulating hormone during ovulation, it will rise to the peak again, and then it falls immediately. And then when this follicle, the estrogen reaches peak, the luteinizing hormone peaks over and then it falls. Then we have this progesterone hormone taking over now the luteal phase until this woman starts bleeding again. And she will only bleed if these hormones falls. This woman will only bleed if the progesterone hormone fall and if the estrogen hormone fall. So for those who have issues, they don't bleed, they can stay for 60 days, 80 days without bleeding. Already we have a clue. The progesterone hormone has issues, the estrogen hormone have issues, and there is a high possibility this lady is not ovulating. So it gives us a clue of many disorders in a woman. So let us learn to appreciate our menstrual cycles. Let us learn to take care of them. Let us also know if there are issues that you have, please see a doctor so that we can correct this before it becomes chronic. So please don't forget to subscribe to my channel and join us in the next video. We shall talk more about obstetric complications and some of gynecological disorders that we as students and even to those who are listening need to understand about. Because the more you get to know, have this knowledge, the better we become. We become good doctors, we become good clinicians. And also, for you who is viewing my channel and who is listening to me, you are able to understand if you have a problem, or you can even help others who have a problem, and you can ask them to visit a gynecologist who is near, or visit any gynecological clinic, and she'll be attended to. Thank you so much. Please don't forget to subscribe to my channel and continue watching and following me. May God bless us all and keep us in His love. Thank you.